Hi, I'm Dr. Ludwig Allegra of Northwest Face and Body, and today I want to talk about a great procedure, mommy makeover. What is a mommy makeover? Basically, it's addressing two areas that are, quite frankly, affected by the process of being a mommy, and that's the tummy and the breasts. As one might expect with pregnancies and breastfeeding, the breasts undergo significant changes, and for most individuals, this ends up in a significant degree of droopiness plus loss of particularly upper pole volume. I think that's one of the things that becomes most apparent. There's just simply no fullness left anymore, and the breasts start becoming, they feel heavy. A part of the mommy makeover is correction of this with a lift and augmentation type of procedure. The second part of the mommy makeover is dealing with the tummy, and obviously many individuals will have lost elasticity, will have redundant tissues and hanging tissues, which of course are troublesome in terms of clothing fitting well, and just having the appearance of a nice flat tummy, which they may very well have started with prior to being a mommy. Addressing these two issues is in fact the mommy makeover. My approach to this is, if at all possible, to try to combine these procedures. We have developed techniques to be extremely efficient at being able to do this with a relatively short surgical time, which makes it practical for most individuals to, in fact, have one surgical procedure that addresses both issues, one recovery, and so within a matter of literally 1 week to 10 days, be surprisingly back to normal activities. So very specifically, with the augmentation lift type of procedure, this is a very gentle procedure that is basically tailoring the tissue. It is restoring the position of the nipples so that things are now well projected and supported. We are restoring the upper pole fullness and the general fullness of the breast with adding a breast implant. The implant I generally like to use for these procedures is the so-called gummy bear, which is a cohesive anatomical type of implant. This provides a significant amount of support, if you will, and then the tailoring of the tissue to create nice roundness and fullness and the excellent aesthetics that can be achieved. This is a procedure whereby, without a bra, there's no longer a sense of heaviness, and I think one of the things my patients truly appreciate afterwards is that they no longer feel that they need to support and lift tissue, and this takes away a lot of strain. A lot of individuals end up with shoulder and back problems that are pretty much eliminated by considering a procedure of this nature. With the tummy, this is an immediate and dramatic resolution. It is an elimination of all of the excess tissues. It is a tightening of the muscular structure underneath that has often been ballooned out, or having outright what's called diastasis recti, which is a true splaying of the muscles from previous pregnancy. This is all readily restored in a very efficient fashion. So with our techniques, we're able to perform this surgery in generally 4.5 hours, which is a relatively limited timeline. This allows for extremely rapid recovery. My average patient at 10 days is remarkably functional and will often tell me it's not even a thing. It truly is surprisingly fast from that perspective. These are procedures that can be done with extremely little bruising or swelling and very little discomfort. The basic concept is combine the procedures, have one anesthetic, have one recovery, and basically address both of the issues that now will become virtually permanent in resolution. My patients are very pleased with both the rapidity of recovery, but also the immediate elimination of all of the heaviness that has been the outcome from the previous pregnancy. Literally clothing fitting better immediately, being able to resume normal activities in a rapid fashion. So visit us for more information.